Relationships are the key to successful advocacy. Now more than ever, in this overabundant time of messaging and clicks and noise.
CBO came out with an estimate that 10 million people are going to lose their health insurance coverage. When something like that happens, health centers stand to be impacted in a couple of different ways.
I don't want to sugarcoat the One Big Beautiful Bill, or HR1. The impact is deep and the cuts are deep. Hi everyone, welcome to Community Health Centers Unfiltered, where we tackle people, politics, and policy that are driving community health centers forward. My name is Amanda Pears Kelly. I'm the CEO of Advocates for Community Health, and I am a part of a fantastic team who is going to join me in this conversation on a regular basis. But today we're going to do something a little different. We're going to have a conversation about a recently passed piece of legislation, the One Big Beautiful Bill, HR1, or the budget reconciliation. There's a lot of different names for it. But the reality with this bill is that it is far-reaching, and there are huge implications for health centers and for the patients health centers serve. It's everything from funding to work requirements to accountability and everything in between. There's also a timeline associated with this. And so the implications are today, immediately, but also looking forward. We're going to have all of those conversations and have that conversation specifically about what the impact looks like, again, to health centers and the patients they serve. I'm looking forward to having this conversation. We've got a couple of experts with us to really dig in and unpack what this looks like. And we're welcoming you to follow up with us, to ask more questions, to join us in continuing to look at how this bill is going to unfold, and to do everything we can possible to make sure that there is the best case scenario for health centers and the patients that they serve. So let's get into it.
My name is Stephanie Krenrich, and I am SVP of Policy and Government Affairs at Advocates for Community Health.
And I'm Margaret French, Senior Vice President at Venn Strategies for Healthcare.
So today we're going to have a conversation about the One Big Beautiful Bill reconciliation package.
Hooray.
Hooray. And we're going to talk about how community health centers stand to be impacted by this legislation that passed a few weeks ago now. Why don't we talk a little bit about how Medicaid supports community health centers and the critical role that it plays in their operations? And I can get started with that quickly and kind of answer that question to start with.
Please, fire away.
Okay, I'm happy to kind of get us started. Medicaid is critically important to community health centers. More than half of community health center patients at the moment are covered by the Medicaid program, and it makes up a significant portion of community health center revenue. So when legislation passes, like the one that passed a few weeks ago, that will cause, I think today CBO came out with an estimate that 10 million people are going to lose their health insurance coverage. When something like that happens, health centers stand to be impacted in a couple of different ways. They may see increased numbers of uninsured patients, so that will mean that health centers aren't going to be getting revenue from insurance coverage as they see patients, but they're also going to lose out on Medicaid revenue that they otherwise would have gotten, that reimbursement for services. So Medicaid does make up a large proportion on average of community health center funding. It's one of the main sources of funding for community health centers.
I think it's just important to talk a little bit about, obviously we're focused on community health centers here at ACH, but this is going to really reverberate throughout the healthcare ecosystem, especially for those safety net providers that, again, see high proportions of Medicaid patients or patients without coverage at all. This is going to cause disruption in communities, could lead to economic losses for those communities. Additionally, I think one of the things that providers are really worried about is the delay in care that might occur. People with chronic diseases will progress, they won't get access to those critical screening and primary care services, and ultimately they may end up not even being able to go to a community health center, rather seeking care in, their rural hospital emergency department or something like that. So not only is it community health centers and the communities they serve that are going to be impacted, really the whole healthcare ecosystem is going to be impacted by these Medicaid changes.
Absolutely. And I guess looking at the bill, what specific provisions are there that I think folks are really looking at, both community health center providers and other providers? Which ones do you think are going to have the most impact?
Yeah, so I think there's really a twofold access and reimbursement issue that these Medicaid changes included in the bill will have. On the access side, there are significant changes to both eligibility and enrollment for Medicaid patients. Shorter enrollment windows, more hoops to jump through. Lawmakers instituted what they are calling community engagement requirements, otherwise, colloquial known as work requirements. So patients are going to start having to really prove again and again that they are meeting those new requirements, their income levels, their addresses, and that's just kind of bureaucratic red tape that unfortunately will cause a number of actually eligible patients to likely fall out of the program. So that's a huge concern, obviously, from the coverage access side. And then on the reimbursement side, there were two really significant changes to the way that states finance their share of the Medicaid program. So of course, Medicaid jointly funded by federal and state together, but the state financing of that share can be done through a variety of different, beyond just general revenue in the Treasury. One of the ways states do that is by a provider tax. So taxing providers, they're able to pull down, an additional federal share to match that tax, and then they're able to reinvest that back into the healthcare ecosystem, usually through what are known as state-directed payments. And these are state-specific payments that go straight to safety net providers to support, again, the care that they give to Medicaid and uninsured patients. So there will be significant changes to both the provider tax and state-directed payment provisions that will likely really squeeze states and state Medicaid budgets specifically. So we're very concerned about both of those two provisions.
So what I'm hearing you say too is that there likely will be other indirect impacts of this bill beyond what's actually in the statute. Because as state budgets get squeezed, they're going to have to be looking for other ways to make up the difference in Medicaid and how they were supporting Medicaid. It could have reverberations through state budgets in a lot of different ways.
Certainly. Yeah.
As we're talking about provisions in the bill, I want to talk a little bit about the Rural Health Transformation Fund that was included. There's about $50 billion included in the bill for providers. Although it's called a rural fund, it's not necessarily just for rural providers. And there are still a lot of details about this provision that I think are unknown at this time that still need to be fleshed out. So there is this $50 billion fund in the bill for providers, including hospitals and community health centers, to apply for funding. And I will say, $50 billion is probably, definitely not enough to help kind of stem some of the issues that providers are anticipating as a result of this bill. But I wanted to make sure that I talked about that as well, because it is going to be a source of additional revenue for some community health centers, kind of depending on how the process goes and everything else. So I did want to make sure that I mentioned that as well. And I didn't know if there was anything else about the rural fund that you wanted to talk about.
Yeah, $50 billion sounds like a lot of money, but, in our world, it really isn't. I also want to highlight that is not $50 billion this year, right? This is over a period of several years. It'll be $10 billion this year, $10 billion next year, $10 billion the following year, with less in the outlying years. And so, it's not one big lump sum, and it's also going to be stretched over a number of different eligible providers. So there's been a great deal of focus on Capitol Hill about the impact to rural hospitals specifically. One thing I think is critical for ACH members and all community health centers is to ensure that they are not overlooked in the disbursement of these funds. It'll be split down the middle, so it'll be $5 billion will be funneled through the states equally, and those states will have authority over, where those funds go. And the other $5 billion this year is going to be dispersed by CMS directly. Mm-hmm. So, at the federal level, there will be some policy decisions made where they want to infuse those resources. And, from an advocacy perspective, it's just absolutely critical that community health centers are not overlooked.
Absolutely. Absolutely. Now, thinking about the patients at community health centers, kind of how do we think that this legislation is going to impact patients themselves? And I think that on one hand, I think that folks are really going to have to work a lot harder to maintain their Medicaid coverage. Coverage losses in this bill are largely a result of increased red tape. They are, at least as estimated by the Congressional Budget Office, the reason folks will lose coverage is because they are going to have to jump through more hoops to access their health insurance coverage. So they're going to be doing redeterminations of whether or not you're eligible for Medicaid twice a year instead of once a year. I know, Margaret, you were talking about the community engagement work requirements, and that's another proving that you either meet an exemption or that you are working or that you are trying to find work. How all of that is going to be operationalized really remains to be seen. So the question is really how well will community health center patients weather some of those changes? How well will they be able to navigate the system? I think when you have folks who tend to be more medically complex, tend to be at times, lower income, maybe folks have one or two jobs, maybe they're juggling caregiving responsibilities. Really, it's going to be how are folks going to be able to weather that and still maintain their coverage. I don't know if there's anything else you wanted to add to that.
Yeah, a few things there, Stephanie. First, we're not going to see any rulemaking from CMS, the agency in charge of administering Medicaid, until next year.
Yeah.
So there's going to be a delay between all the press around this bill and what's happening and, maybe some of the negative consequences even, and when, those consequences actually take effect. Mm-hmm. And I think that delay is confusing for patients and communities. I think that's going to be a big challenge in terms of navigating. The other thing that's difficult is each, state program is going to be administered a little bit differently. So, it's going to be challenging from a national perspective to give a lot of tactical advice to folks. It's going to be really up to, state and local communities to be sure that their folks have the information they need. And at a time when resources are limited, we're asking these communities to do more work, yet, another thing, helping patients navigate yet another hurdle. It's going to be a challenge.
And can you talk a little bit about that timeline quickly? You just alluded to the timeline here, but are there any kind of implementation timelines that we need to be keeping in mind as we're sort of looking to the future and how this bill is going to roll out?
Yeah, that's a good question. So some of the effects of the bill are already live. Mm-hmm. For example, there was a prohibition on certain family planning and abortion services for Medicaid funding for those services. That's already in effect. There were a number of delays or moratoriums, as they're statutorily referred to, on programs the Biden administration wanted to roll out regarding staffing levels, regarding CMS's approval of those state-directed payments and provider taxes that I mentioned. All of that is frozen right now as of today. October 1st is a really important date to keep in mind. That is when that Rural Health Transformation Program application process opens.
And that's for states to apply?
For states to apply,
okay.
Correct, October 1st. We expect to see, something in the way of informal guidance from CMS probably in early August, hopefully. But again, as you mentioned earlier, there's really not a lot of clarity around how this process is going to be implemented there. Some of the other larger policy changes don't take effect until 2026, including those community engagement rulemaking, which will then, go live January 1 of 2027. But as far as things that your folks need to know immediately, they need to be really focused on that rural health fund that is going to be kind of the talk of the financial safety net community this fall.
Okay. Let's talk more about that, about next steps for health centers. So obviously the Rural Health Transformation Fund, we will be following that very closely and communicating often with our members about how they can best plug in and access those funds. What other next steps are there for community health centers and their leadership and their What advice would we give folks about next steps?
Yeah, the first thing, the most important thing that ACH members can be doing right now is undertaking a full analysis of what these changes mean specifically for their facilities and their workforce and their patients. Frankly, lawmakers didn't have a lot of information to go off of when they were considering these changes. They had some CBO estimates, they had some informal analysis from stakeholders, but providing that data and a clear picture of what this means for health centers, I think, is the single most important thing that ACH members need to be focusing on. Communicating with each other. Mm-hmm. Your members are a wealth of knowledge. They are the best at what they do. Just because their state program is different than another member's state program doesn't mean there aren't lessons to be learned or pilots to be run. And I think that cross-pollination among, community health center leaders that are members of AEH is absolutely critical. Another component is it's time to activate your grass tops at the state level. It is time to look at who's on your board, who are your biggest champions. You need to be strengthening those relationships and letting them know what they need. This is also actually a really good opportunity to build new bridges with state representatives or local officials that you haven't worked with, and also at the federal level, in your congressional delegation. Now is the time that we really need to be focusing on those relationships, because the reality is the decision has been made. The bill has been passed. It's been signed by the president. Mm-hmm. There's a long road to implementation, which we talked about a little bit, and likely probably some legal challenges along the way. But these policies are moving forward. Mm-hmm. And so what we need to be communicating to, those that can pull levers for us at the state, local, and federal level is what resources do we need to continue to maintain access to care and services in these underserved and rural communities.
Absolutely. And I will say, too, from ACH's perspective, as we look at what's next in the federal government, what we're looking at in terms of federal advocacy, the Community Health Center Fund is expiring on September 30th. So that will be up for reauthorization. The appropriations process is ongoing. That's the federal funding process, which is what it is this year, but such as it is ongoing. And I think looking at opportunities for us to really communicate to members of Congress, to members of the administration, the resource needs of community health centers backed by data, as you were saying, I think is going to be really, really important. We also have conversations happening behind the scenes right now on the 340B program and potential 340B reform. Those work streams on 340B and reform have been ongoing for a couple of years, and those conversations are picking back up again. So what do health centers need from that process to ensure that they have the help and assistance they need to be able to continue to serve patients the way that they need to? I mean, community health centers provide the gold standard in primary care throughout this country to medically complex communities, people in underserved communities, in rural communities. And we need to make sure that health centers continue to have what they need to be able to provide that gold standard of care. And you were talking a little bit, too, about kind of outreach to state representatives as well, and kind of as states really grapple with taking on more of the burden of funding Medicaid. Because, I mean, as we know, Medicaid is a state-federal program. There's a federal match, and then also states provide funding. But this bill changes what states are allowed to do in terms of how they fund their Medicaid programs. Do you have any advice for community health center leaders, to primary care associations, others, about how to communicate the needs of community health centers at the state level, sort of what to focus on and how best to do that?
Well, I think the colloquialism "politics is local" really applies in this case, because again, having those data points is critical, but it's not enough to enact change. You really need those champions fighting for you to help deliver and amplify that message. So again, building bridges now is more important than ever. you were talking a lot about kind of the holistic view of what health centers need. I think something that often gets lost in these nuanced policy discussions is that holistic view.
Right.
It's, this provision or that provision, this impact on this type of patient or that type of patient. The reality is these decisions aren't made in silos.
Right.
And, communicating your needs across the board, across the spectrum, beyond even the Medicaid space is going to be really important at the state level.
Right. And I think as we're talking about this too, we definitely want our state lawmakers to resist the pressure to reduce reimbursement rates through Medicaid. We have the PPS for community health centers, which we are very grateful for, but the rates often aren't what they should be. And we want to make sure there's no downward pressure on those rates as these conversations are happening. I think it's interesting as we're having this conversation. I think this is a time of a lot of challenges right now for community health center financing. There are opportunities, but I think at ACH we're really laser focused on helping members and folks in the wider community really weather a lot of those challenges. Looking ahead, what should we be watching out for in terms of policy or funding that could, I actually already answered that question, so I am not gonna, we can talk a little bit about it, but what should we be watching out for in terms of policy or funding that could affect community health centers in the near future? I know I talked a little already about it, but.
Yeah, no, there's a couple opportunities. This Congress, the 119th Congress, look, Stephanie, regular order on Capitol Hill is gone. It's out
done.
The window.
Yep.
And it's, CRs, it's big packages that move a ton of different unrelated stuff. That is the playbook these days.
Right.
And the 119th Congress has been no different. They have passed basically 2 major packages all year. And, August recess is like tomorrow.
Right.
So other than the CR and, the reconciliation bill that we've been discussing, there has been very little regular order. And so it's incredibly challenging looking ahead to what vehicles could any sort of policy fixes ride on. The reality is you basically mentioned them already. Mm-hmm. Appropriations, which is, everyone thinks we're on the CR train. I think we're on the CR train.
Which is a continuing resolution, right?
We're flat funding, same, kick the can down the road.
Right.
There's the National Defense Authorization Act, NDAA, which is a must-pass bill every year. It funds our military. Oftentimes, lawmakers will try to put little things in there that aren't necessarily related to defending our shores, but... Right. It is a legislative vehicle. I think that's going to be extremely hard to do this year.
Yep. And that's something that always passes, and there has traditionally been really strong bipartisan support for it, but
Absolutely.
I think this year's going to be tough.
I think it's going to be tough, and I think it's going to be tough to get extraneous things in it.
Yeah.
And then lastly, on the healthcare front, there really is 2 question mark opportunities, and that is the bipartisan health package deal that was scuttled at the end of last year that addresses, the CHC fund, among other really important funding extensions. But Republicans are going to need Democratic help for that and Democratic votes. And this is not a climate in which Democrats are very likely or willing to extend a helping hand to their Republican colleagues. The other big question mark is Reconciliation 2.0.
Right.
2.0. We heard from lawmakers time and again when we were on Capitol Hill advocating for community health center needs that, this one big, beautiful bill acts as a tax bill. It's not a health bill. There's some health things in there, but this is a tax bill. There'll be a health bill down the road.
Right.
And they continue to kind of stick to that messaging. However, last week you had the chair of the Ways and Means Committee, Jason Smith, coming out really expressing doubt that there would be another reconciliation kind of magic bill for Republicans to get everything else, included.
Right.
So those 3 opportunities, 4, I guess, if you count the deal that's scuttled, are really the only game in town on the legislative front.
Right. And I think for community health centers, we are going to really need a vehicle for our reauthorization of our fund. And I think that's going to be taking up a lot of the conversations that we're having on the Hill, is going to be how do we ensure a robust multi-year community
Right.
health center fund authorization, which might be a tall order this year, but it's something we're really going to be working towards.
It is a tall order, but, I don't want to be all doom and gloom here.
Right.
The reality is the work that you all do and the patients you serve are the bedrock of American communities.
Absolutely.
They really are. And, you and others at ACH, Amanda, have done great work to ensure that community health centers have a voice and they have a seat at the table. And there are a lot of scary things on the road ahead and a lot of uncertainty, which makes, running any sort of facility challenging, especially when we're dealing with, at-risk and needy populations. But there are opportunities ahead, and you have positioned community health centers in as good a place as possible to have those conversations. I think, unlike some of your friends in maybe the hospital community that no longer maybe wear the white hat that some thought that they wore before, you guys still do. You still are the voice of the good guys in the healthcare continuum community, and that is a real asset. And so leveraging, again, the real data that your members are collecting, the anecdotal patient and workforce stories, the champions at the state, local, and federal level are going to allow you to have those holistic conversations about the need to shore up 340B, the need to increase funding through the CHCF, the need for perhaps new funding streams under the Make America Healthy Again initiative.
Right.
These are conversations that you're well positioned to have. I know sometimes it feels like you're fighting a battle on 100 different fronts, but those are also opportunities and places where your members can and should be engaging.
Absolutely. And you're bringing up an excellent point. Community health centers have long enjoyed strong bipartisan support. And we do enjoy a lot of support from members of Congress now. And I think that kind of going into the end of the second half of this year, I think that that's something that we can really focus on and kind of look at these what we're doing right now as opportunities to really work at getting health centers what they need. Something that we haven't yet covered yet is kind of the process by which the One Big Beautiful Bill passed. I guess I'll start and then please jump in, just so that our folks listening to the podcast have a kind of a picture of sort of the process this year and how it was different than in the past. And I think that what we have really observed about that was just it was a very fast process. It was very fast. It went a lot faster, I think, than a lot of experienced folks were anticipating. And it moved through in a way, I think, where all of the Republicans in the House and the Senate really stuck together. And it was just it seemed like a very inevitable process, I think, during the whole during all of our advocacy. And I'm not sure if that's a great way to put it, but I don't know if you had any other thoughts on process.
As a Republican, the Conservative Party, they're a small tent party.
Yeah.
They don't necessarily have to deal with a lot of the infighting that their colleagues on the Democratic side of the aisle do. However, there were two main factions that were really slowing down the process and throwing a lot of doubt, and that was the House Freedom Caucus folks, very conservative, that wanted far deeper spending cuts and were really actually unhappy with where the bill ultimately ended up. And those moderate kind of swing district Republicans that were understandably concerned about their constituent perception and impact in, these purple districts where they're going to have to run for re-election in like a year. Yeah. So it wasn't without its hurdles. I've heard some folks describe the process very kindly as inelegant. Mm-hmm. So that's the word I'll use. It was inelegant, but there was a forward momentum driven by the White House that really got this thing across the finish line.
What's one thing you hope every listener takes away from today's conversation about the future of community health centers?
One thing every listener should take away about the future of community health centers is relationships. Relationships are the key to successful advocacy. I think they always were, but now more than ever, in this overabundant time of messaging and clicks and noise, those personal relationships that have been built and nurtured, over sometimes decades in some lawmakers' cases, those are the folks that will get what they need, the folks that have those relationships. And this reconciliation process was a great example of that. The rural fund got in because a couple of senators said, this is my number one issue.
Yep.
Not, this is on my list, not, I'm hearing from constituents about it. This is my number one issue. And in our tight margins in both the House and the Senate, that's the kind of strong support that you need. So investing in those relationships, building those relationships, nurturing them, care and feeding, I just can't underscore it enough.
So there is a ton to talk about in terms of this very significant bill that just passed, which has many names. I will also add it's HR1, it's the One Big Beautiful Bill, it's the reconciliation, it's, there's a lot of names for it. But it has been front and center for months. Obviously, tons of policy and advocacy work for quite a long period of time. But now we know what we're working with. It's passed. One of my questions for you is, what strikes you as the most concerning and then, or kind of worrying? And then what are you looking at in terms of potential opportunities? Or where are we still waiting for information even? All of it.
Okay, so I think the most concerning aspect of the bill, obviously, as I'm thinking about it, is obviously the Medicaid cuts. I think that this bill does cut almost $1 trillion from the Medicaid program, which for community health centers, where more than half of their patients are covered by Medicaid, that is going to be concerning. So we've had the Congressional Budget Office come out just today with a revised estimate of coverage losses from the bill. So about 10 million people are projected to no longer have Medicaid coverage once this bill is fully implemented. What does that mean for community health centers? That means more uninsured patients and less Medicaid revenue. And I think that for health centers who operate on extremely small margins anyway, on a good day, we are looking at this as a challenge, and one that we are going to help our members weather as best we can. And we are going to be making sure that we are helping our members kind of do everything they need to do to make sure that they come out of this okay. So some of the opportunities in the bill, I think there is a Rural Health Transformation Fund in the bill. There's a $50 billion pot of money in this legislation for all providers to apply for. I think there's still a lot we don't know about how this is going to be implemented. The pot of money itself does exist. It's not nearly enough for the amount of providers that will be needing money from it. And I think for us too, kind of being very closely in touch with administration officials, with state officials, to make sure that we know as much as we can about this fund to help our members benefit from it as much as possible. So that's kind of what I'm thinking about that.
There's a lot there, and I have a million questions as usual.
Yeah.
So one of the other things I was going to ask you about is there are so many unknowns with this, where we now have the law, but in terms of the way it's going to be implemented and enforced and sort of the framework around some of it, it is still unknown. So can you talk me through where that information is going to be coming from, and as much as you can call from memory, the timeline around when we'll be able to see some of those things?
Absolutely. So I think that for something like the work requirements, community engagements, they won't be implemented until 2027, although states are really going to have to be laying the foundation now for how those processes are going to work. So that's one of the timeline pieces that we are following very closely. When we're looking at something like the Rural Health Transformation Fund, October 1st, states are going to be able to start applying for those funds. The way that is structured is that half of the funds are going to go to states to distribute, and then half of those funds are going to be distributed by the administration, by HHS. So thinking through how both of those types of processes would work and helping our members navigate that is going to be a huge priority for ACH. There are some things in the bill that are already in place. There are some family planning restrictions for abortion-related services that are in effect immediately, that are in effect right now. There are items related to the provider taxes and state-directed payments, where those processes are in place, or at least those, the ball is rolling already on kind of some of the policies that were included in the bill.
Yeah, so the other thing that I was thinking about, or I have been thinking about for quite a long time, but definitely as we now have moved into a space where this is now reality, the impact is significant in a lot of different layers here. So first and foremost, it's patients. You know, health centers are serving 32.5 million people, which is amazing. But without coverage, that changes access for a variety of different reasons. So you have the impact of patients. I know the estimated losses are between 10 million and...
So right now, for the impact on patients, it's about 10 million according to CBO for the bill itself, and about 5 million more people as a result of the changes in the ACA subsidies and the Obamacare subsidies.
Yeah.
So that's about 15 million people.
It's a lot of people.
Yeah.
So I think health centers, fortunately, as you know, are going to serve these patients regardless of coverage or status. And so on the one hand, I'm so grateful that the safety net is going to continue and persist. But I think another layer to this, and I know we've talked about it a lot, but another layer to this is that health centers can't just change their rates. They're a little bit frozen in terms of what their operations and what their funding structure looks like. And so when we have that many people falling out of coverage and falling into uninsured or uncompensated care, and there's no additional funds coming in to support that. I know the Rural Provider Fund or the Provider Relief Fund is definitely going to be helpful and super appreciative of that. But it's $50 billion over 10 years, correct?
It's $50 billion over 5 years, so it's $10 billion a year. Yes.
Yeah. Yeah, so, and I mean, my kind of reinforcement there, just as I'm thinking through what does this look like for health centers, I think the estimated losses for health centers was $35 billion alone, correct?
Yes.
Yeah. So, there is a lot of work to do. I think the other thing, I know we had some conversations here in Washington not so long ago with some folks who called out the community engagement component of this and volunteerism. And I think that's a space where, one, health centers are already doing a lot of work in that space, but I also view that as an opportunity where I think health centers can be a really important part of the solution, part of rolling this out in a really effective way and getting people engaged, I think, in line with what the intention is. But do you have thoughts on that?
Yeah, I mean, I think that health centers can be a really important part of engagement on this. I think that health centers are really going to be something that Margaret and I talked about a little bit, is the need for health centers to really be bringing data, really be doing some projections, really studying how they think this is going to impact their individual community health center and bringing that information to their elected representatives. And just the critical importance of relationships with their members of Congress, and really just making sure that they have a really clear picture of the impact of this for their folks, for their patients, and then talking to their elected representatives and really continuing to really solidify and build those relationships with their members.
Well, that's something else I was thinking about. There's this timeline, obviously, for when work requirements and other components of the bill will be rolled out. But the other reality is there's a lot of work to be done for health centers, even from a policy and advocacy perspective, between now and then.
Right.
And I think you're right in terms of the relationships, in terms of continued and persistent engagement to make sure that it's really not about taking a stance one way or the other. I think in a lot of cases it is about speaking to impact, it is about doing the education, and then making this the best case it can possibly be for health centers and for patients. I think outside of relationships, are there any, I have lots of suggestions, but before I chime in with all my suggestions, but any other kind of suggestions that you would make in terms of how folks should be involved?
Well, I think that we should be, I mean, there's a lot of things with relationships, obviously, with making sure you're inviting your members to your health center to do site visits. There's a lot with your members of Congress. But also, I think that as these community engagement, for instance, the new processes are put in place, really thinking through as a health center how you can help your patients navigate that and what resources you're going to need for that. I think that that's something that we can all sort of plug into in terms of advocacy, to think through how could we help patients maintain their coverage as best as possible. I think that's going to be a big part of this. So what processes can you put in place? What programs can you stand up? What programs can you expand to help your patients? So there's that. I think that for something like the Rural Health Transformation Fund, obviously, ACH is going to be working with our members kind of all along the way to make sure that they are on top of application deadlines and making sure that they have as much accessibility to these funds as they can to help, as you said, turn this into the best case scenario. I think that's going to be really, really important. I think that, listen, community health centers are the best story in medicine. So how do we make sure that we are yelling that from the rooftops and making sure that folks are aware of health centers and the incredible work they do in an incredibly efficient and effective way to provide the gold standard of primary care. This is quality care that they're providing their patients. So making sure that we continue to tell that story and, really tap into existing kind of work streams on Capitol Hill, for instance. I'm thinking about things like Make America Healthy Again. Where, for that, I think a lot of the work on the Hill on that is focused on things like chronic care management and primary care and food as medicine and nutrition programs. How can we make sure, too, that community health centers are tapping into those kind of incredible opportunities for collaboration, across the aisle with Republicans and Democrats on some of these initiatives there? Yeah, I think the name of the game is kind of really helping community health centers continue doing the great work that they're doing. And we may need to be thinking creatively, right, about how best to tap into maybe some or some funding streams that we haven't thought about before. But how can we really think creatively and make sure health centers are in the room and at the table when conversations are happening about resource allocation, about things like the Rural Health Transformation Fund, and about other kind of priorities for folks in leadership in Congress and in the administration.
Yeah, I'm glad you said that. I think I don't want to sugarcoat the One Big Beautiful Bill or HR1. The impact is deep, and the cuts are deep. But I also agree with you in terms of constantly seeking opportunities and calling out what health centers do really, really well and seeking conversations to say, okay, how can we be innovative? How can we provide those additional solutions? I think there are things coming up, and I know, conversation with Margaret around, what's coming and where might there be opportunities for some of those funding discussions and, specific support for health centers kind of as a holdout or a pullout. But I will also say, just as the forever grassroots girl, I also think that one of the things that's so important right now, and just watching the process the last several months, is that it really also has to be about empowering patients to tell their story. And there's the story that is, okay, what does your day-to-day life look like, and what does the health center mean to you? But I think the other part of the story is, as this rolls out, how has this policy impacted you? And I think being in good communication and being civically engaged, showing up at community events, participating in events where policymakers, not just members of Congress, but also your state, your local, to tell them, because the only way that they're going to get that education is when they hear it from the people on the ground who are experiencing it. And I'll be the first one to say healthcare is enormously complicated. My goodness, between the work that we do, but even just on a personal note, like trying to help my own family who are a little older in years navigate the healthcare system or deal with insurance, or all of the different pieces, it's complicated. So I think for our patients, it has to be about understanding what this means for them. I think health centers have a role in that. And again, it's not about taking sides. It's just literally about looking at what is actually going on and then telling that story and showing up. I think, I think about grassroots. It has to be consistent and persistent. And I think we've lost a little bit of that. So that's something else I'm honestly looking forward to tackling in the next, immediate, but also looking further down the road, because there's nothing more important or powerful than that voice. And I think when we are all together and it is one collective voice, the impact of that is immeasurable. So it can be a really bright future, but it's going to take work. And I think it's going to take creativity, which we have always been up to the task for. So really, again, I'm not going to sugarcoat, but I do see that there can be a really bright future here.
Yeah, absolutely.
Thank you so much for joining us, everybody, for our very first episode of Community Health Centers Unfiltered. We are so excited that you joined us, but also to help us unpack this really lofty, very heavy issue. Medicaid is not just about numbers on a spreadsheet. It's not just about talking points or even policy briefs. It's about people. It's about health centers. It's about the impact that policy has on both of those constituencies and far wider than that. If you want to learn more, we want to hear from you. We love hearing from you. We always learn from you. We want to share as much as we can. You can subscribe to Community Health Centers Unfiltered for more conversations like this. The other thing I would say is until next time, just take care of yourself. We're so appreciative of who you are and joining us today, and we can't wait for the next conversation.